it goes to the joints.
Yeah.
And like you say, a lot of fever,
Mhm.
spikes, so it's not good.
Yes, with this undulant fever, the first time you get that fever, it's worse and longer than the next. It kind of goes away after you get the fever, and then it comes back again. Not so high a fever, and maybe not for so long, and then it goes away, and then it comes back. Did you have that coming back and going away with your fever?
I was treated on time,
Mm-hmm.
so I guess, but I know it keeps dormant,
Mm-hmm.
especially in the bones. So.
It's interesting to know when people have had these diseases that we talk about, because they seem sometimes they seem so far away, like you wouldn't think it would infect you would have any problems with them. It is the most common bacterial zoonosis, and there are 500,000 new cases per year, and it's endemic to Mexico, the Middle East, and it gets imported to the U.S. through unpasteurized food products. One of them is these Mexican soft cheeses that they have. And once that bacteria gets into the body, they get ingested by macrophages, because that's what macrophages do. That's part of your immune system. That's their job. Go out and take out the invader. So they ingest these bacteria, and then they get transported through the lymphatic system to the liver, the spleen, the bone marrow. However, these bacteria can live inside those macrophages and reproduce within the macrophages. And so it makes them more resistant to antibiotics and your own immune system, because they're inside another cell. Anthrax is caused by the pathogen Bacillus anthracis. You work with Bacillus subtilis. So, and the bacilluses are common soil bacteria, which anthrax is the disease caused by this bacillus. That's where it comes from. And the spores actually can live or survive for about 60 years in that soil. So we know that bacillus is an aerobic, gram-positive, large rod, and it forms endospores. And these endospores for this particular pathogen infect grazing animals. They multiply in large numbers in the blood, and septicemic anthrax is possible for all three forms of anthrax that we're going to talk about, meaning that it can get into the blood. One form is cutaneous anthrax. It's the most common form. It's transmitted by contact with infected hides, wool, or animal products, especially from the Middle East. Endospores enter your skin through a minor skin lesion. Next, a papule is going to form, and then vesicles. And then the vesicle is going to rupture, and it's going to form a depressed ulcer that is covered by a black scab. And they have pictures, they have pictures in your book of these things that you can look at. So there's a picture of that ulcer that has formed and has a black scab on top of it. Symptoms are a low-grade fever, malaise, usually doesn't enter the bloodstream, but if it does, then sepsis can occur. So the mortality rate for cutaneous anthrax without treatment is 20%. And with treatment, it goes down to less than 1%. remember after 9/11, somebody in this country mailing anthrax spores to politicians and news people. Now we irradiate the mail. There's also gastrointestinal anthrax. It's a rare form, and it's caused by ingestion of undercooked, contaminated food that's been contaminated with spores. Symptoms are nausea, abdominal pain, bloody diarrhea, and then you get these ulcerative lesions all the way from your mouth down through your intestines, so it's all through your GI tract. Mortality rate with gastrointestinal anthrax is greater than 50%. The worst form is the inhalational or pulmonary anthrax, the most dangerous form. Endospores get inhaled into the lungs, and eventually they enter the bloodstream. So initial symptoms are a mild fever, coughing, chest pain. And if you were to suspect that you have been exposed to anthrax spores, then you could be treated with antibiotics, but you may be exposed and not know anything about it. If the bacteria enter the blood and start multiplying, then septic shock that happens, and that can kill the patient within 24 to 36 hours. And with that, there's almost 100% mortality rate.
Even with treatment? Even with treatment?
Well, if they know that you have, well, once it gets into the septic shock, you know, if it's gone that far, yes. The virulence factors are the endospores are ingested by macrophages, and then once they get in the macrophage, remember the macrophage usually digests something and spits out pieces, but now when the spore's inside the macrophage, it germinates, and when it germinates, the spore, what comes out of that spore once it germinates? A what?
Cell?
Yeah, a bacterial cell. That's your vegetative cell. Well, once that happens, then those cells can start to multiply. You know how a cell goes through binary fission and makes a new one. So they multiply and then they kill the macrophages, and that then decreases your body's autoimmune, or not autoimmune, your immune system defenses. So to diagnose this anthrax, if you think you've had it, the presumptive test would be a Gram stain. Test to differentiate Bacillus anthracis from, say, Bacillus subtilis. And a confirmatory test is done at the CDC. For animals, they have a vaccine. It's live attenuated vaccine. For human, it's an inactivated form of toxins, and you have to take 6 injections over a course of about 18-month period, and then you need yearly boosters. And I believe they give these to these anthrax vaccines to military personnel that are going overseas.
What's the test to differentiate between the anthrax?
Oh, that would have to be maybe different biochemical tests, because they look the same as the Gram stain.
Yeah.
But you know how you do a Gram stain for spores, and the differentiating is between different biochemical tests and medias that maybe one bacteria would ferment something. Or they have that little strip that we looked at where they have a bunch of little tests, you add your bacteria to, and it's a bunch of little tests, biochemical tests. They probably do that, and they have a special one just for, Bacillus anthracis. So, just a recap, the gram-positive rod, which you already knew. In that picture there, those clear spots, that looks like a gram stain. So the clear spots there are actually the endospores, but they don't stain on a gram stain. Remember, we had to heat them and use different dyes to be able to see the spores. Has animal reservoirs. You can get cutaneous or pulmonary forms. Those are the most common. That gastrointestinal one is pretty rare. It produces two exotoxins, edema and lethal exotoxin, and then a protective antigen that binds the toxins to the cells. And it has been used as a biological warfare agent. Gas gangrene. Pathogen is Clostridium perfringens. It's an anaerobic, Clostridium's anaerobic, also a spore former, forms endospores. It's gram-positive, and it's also found in the soil. So with and remember, Clostridium can cause, we have Clostridium botulinum that we can get spores in food that doesn't get canned properly, and we have Clostridium tetani where the spores go into a puncture wound and cause tetanus. And Clostridium perfringens also affects wounds, but if you get a wound and your blood supply gets interrupted to that tissue, then it causes what's known as ischemia. It means that no blood is going to that area, and so the wound becomes anaerobic. And ischemia then can lead to necrosis or death of the tissue. And once that happens, then you can start getting gangrene in those tissues because there's no blood. I mean, not no blood. There is no blood, but there's no oxygen either. So as the bacteria grow, they start to ferment the muscle carbohydrates, and that produces gases. Carbon dioxide and hydrogen gas. And the bacteria produce toxins that can destroy the muscle tissue. And if those toxins and the bacteria get into the bloodstream, then it can cause systemic illness. And without treatment, the condition can be fatal. Bacteria can also invade the wall of the uterus. You have an improperly performed abortion. Treatment for once you get gangrene is removal of the necrotic tissue and amputation. And if you get it in your abdominal cavity, then you have to go into what's called a hyperbaric chamber where they have pressurized oxygen in there. And then you would also receive penicillin to kill the bacteria. Here's a picture of a hyperbaric chamber that you would go in, and you would be receiving pressurized oxygen. Be in a oxygen-rich environment. Here's a drawing of gas gangrene. Gangrene is that death of the tissue. And when your tissue gets like that, you get a foul smell, and the surface of the tissue starts turning blue or black color like that. Here's some actual pictures of gas gangrene. You see this guy's He's already had his second toe amputated.